Let's uncover the chilling reality of lobotomy, a surgical procedure that once promised to cure psychiatric disorders by altering the brain. It may sound like fiction, but it's a chilling chapter of our not-so-distant past. Lobotomy, a procedure developed in the early 20th century, aimed to treat severe psychiatric conditions when there were limited alternatives. Mental institutions were overcrowded, and the only known treatments included electric shock therapy, often resulting in broken bones. In the 1930s, during a neurosurgery congress in London, an experiment with two anxious and neurotic chimpanzees caught the attention of Portuguese neurologist Egas Moniz. After removing part of the frontal lobe from one chimp, its symptoms vanished, making it more docile and calm. This experiment sparked Moniz's interest in applying the technique to humans. Lobotomy involved drilling holes into the skull and injecting alcohol into the brain's cortex to kill specific brain tissue. Over time, the procedure evolved, using a tool called a LOBOTOMY to slice brain tissue based on the patient's condition. Moniz's team reported success with lobotomies. Some patients improved, while others were cured. These initial results legitimized lobotomy as a treatment, leading to Moniz receiving a Nobel Prize in medicine. In the United States, psychiatrist Walter Freeman popularized lobotomies. Despite not being a surgeon, he introduced a faster technique by inserting an ice pick-like tool through the eye socket to destroy frontal lobe connections. Freeman's lobotomobile made house calls, and he performed thousands of lobotomies advertised through newspapers and television. One of the most tragic and well-known cases of lobotomy is that of Rosemary Kennedy, the younger sister of President John F. Kennedy. Rosemary was born with intellectual disabilities, and as she grew older, her behavior became challenging for her family. In 1941, at the age of 23, Rosemary underwent a lobotomy performed by Walter Freeman. Tragically, the procedure went terribly wrong. Rosemary was left permanently incapacitated, losing her ability to speak and care for herself. She was essentially abandoned in a sanatorium, hidden away from the public eye to protect the Kennedy family's image. Lobotomy was deemed a miracle cure, used for conditions like depression, schizophrenia, and anxiety. However, it often left patients in a zombie-like state, void of emotion and personality. Mortality rates were low, but many suffered severe brain damage. As better medications like chlorpromazine emerged in the 1950s, lobotomies declined. The procedure faced criticism, and its effectiveness was questioned. Freeman performed his last lobotomy in 1964. Today, we have a deeper understanding of the brain and the essential role of the frontal lobes in shaping our personalities. Lobotomy, once considered a medical breakthrough, is now viewed as a cautionary tale of medical history. While the era of lobotomy has passed, it serves as a stark reminder of our evolving understanding of mental health and the ethical considerations that guide medical progress. Thank you for joining us on this journey through history. If you found this video intriguing, don't forget to subscribe to Brain Blitz for more captivating content. Remember, knowledge is our most powerful tool.